Good evening all, I'm Aditi Lamba coming to you all from our studio here in New York City. This is Vision of Asia South Asian News segment. Welcome to tonight's episode. We continue to follow updates on the coronavirus pandemic along with the outrage and response to the death of George Floyd. Protests have continued across the nation with demands for racial justice and an end to systemic oppression. The nationwide spread of anti-racist protests are also calling for a defunding of the police department. We will be bringing much insight into the ongoing demonstrations, but again, we urge all our viewers to take all necessary measures of health and safety for all who are partaking in the protests for Black Lives Matter as well as George Floyd. A reminder, we are still in a pandemic. Make sure to wear your mask as well as practice social distancing. Today, the total number of cases of COVID-19 surpassed 1.9 million in the United States, with more than 111,000 deaths as 26 states have seen an increase or a steady rate of new cases. Here in New York City, the epicenter of COVID-19 cases, the city began phase 1 of reopening yesterday after exactly 100 days since the first coronavirus case was confirmed here. Hopeful journey towards economic recovery, Mayor Bill de Blasio urged all to wear face coverings and use social distancing measures as almost 400,000 New Yorkers are headed back to work. What does the reopening mean amidst this social climate of protests and outrage, and where do we all fall in the treatments of COVID-19? Much on that on the episode tonight. Let's begin by the headlines. Black Lives Matter gathered thousands. Justice for George Floyd, Times Square, New York City. Gayatri Chetna Center distributes meals for COVID-19 relief efforts, Piscataway, New Jersey. Dr. Tushar Patel on COVID-19 updates, vaccinations, and South Asian community in New Jersey. It's time for a short break on Vision of Asia South Asian News segment. Stay with us. We'll be right back. And welcome back, I'm Aditi Lamba and this is Vision of Asia. Beginning the episode, we are following the very sad case of George Floyd's death, who was killed in an untimely manner by a Minneapolis police officer, with nationwide protests now continuing to demand racial justice and an end to systemic oppression in the country. Today, George Floyd was laid to rest in Houston, Texas, with his funeral service at the Fountain of Praise Church. One of the dignitaries speaking at the funeral was former Vice President Joe Biden, who said via video that the U.S. cannot again turn away from racism and said that when there is justice for Floyd, the U.S. will be on its way to racial justice. We have now highlights coming in from a recent New York City protest for justice for Floyd, which was organized by Black Lives Matter Greater New York at Times Square. The peaceful protest led by Black leaders of New York City, the demonstration laid a blueprint by Black Lives Matter Greater New York chapter, which calls for members of New York state legislators and Congress to begin an end to systemic racism and call for social justice. The blueprint is also a policy framework to reform failed statutes and regulations. Hello everyone, you are watching ITV Gold and I'm your host Aditi Lamba. We are here at the Black Lives Matter protest happening here in New York City. Join us while we see thousands march for George Floyd and many others against police brutality and against systemic racism. I'm Aditi Lamba bringing you fresh updates here from New York City.
it to the people. Let's get it.
Well, the momentum here is exciting. As the footage will show, Times Square has been shut down. NYPD and Mayor de Blasio knew that we were rallying, and this was such an important message to black people and all marginalized people in America, and they tried to suppress that. What we are releasing today is an agenda. We are calling this meeting today a blueprint. And in this agenda, what we'll be talking about is, of course, 50A, police reform. We'll be talking about police unions. We'll be talking about education. We'll be talking about reparations, which is very important for descendants of slaves, education and housing injustice. So all the things that are currently affecting black people that we are not going to overcome unless we have legislation, that's the blueprint that we'll be laying out today. And for any of you guys who missed it, you can go to my website, ShavonnaNewsomForCongress.com, or you can go to Black Lives Matter Greater New York's website, where we have laid out the plan.
The country is outraged. There have been so many memorials that have happened. I'd like for you to give a message out to George Floyd's family, but also all the ones that are grieving today, with everyone put together thinking that this has happened to thousands of black people for so many years. A message out to those families.
This is a revolution, and I thank every single person for their sacrifice. I view George Floyd, I send my condolences to his family, but he's a martyr. Unfortunately, it was his unfortunate death that galvanized the world. We have Black Lives Matter movements happening in Australia, happening in Tel Aviv, happening around the country, around the world. So, Mr. Floyd, thank you for your sacrifice, because now black people will really get true justice and true liberation. And to the people who couldn't make it out here today, what I would ask you, if you are in the United States, call your governor, call your local officials, and put the pressure on them, because we need the demands and the legislation and policy that we're doing today. We need that implemented into law, and without applying pressure, that will not happen.
Yes. That is none other than Shavonna Newsom, everyone. She is running for Congress.
Yes, in the South Bronx. Go out and vote, June 23rd.
June 23rd, primary.
I'm sick and tired of being sick and tired. It's a shame, but 60 years later, here we are yet again. After we thought we had gotten through Jim Crow, after we thought we had gotten through segregated schools, after we thought we had gotten through voter suppression and unequal housing, here we are yet again 60 years later, sick and tired of being sick and tired. You know, someone reached out to me this week and asked, Rev, how long are you guys going to be out there marching? And my answer was simple. We're going to keep on marching until we overthrow evil in high places. We're going to keep on marching until everyone has a right to health care. We're going to keep on marching until they recognize our basic humanity. We're going to keep on marching until justice flows down like waters and righteousness an ever-flowing stream.
We don't stand just for ourselves. We stand for our ancestors. We stand for our community. Even when the work is hard, we are relentless. And she is the definition of what the future looks like with our youth activists on the ground.
So excited to be here today. I'm so inspired to see all of your beautiful faces out here today. This is like, I've never thought, and I haven't been around for a long time, but in my 19 years of living, I never thought that I'd see this many people rally across the world for Black liberation. So I am inspired.
Hey everyone, my name is Nicole Kiazolu. I'm 19 years old and I'm the president of Black Lives Matter Greater New York. We're out here talking strategy because we need policy that would save and change lives. And we know throughout the system that we live in, policy is one of the most effective ways to change these things. So I'm really, really inspired by all these people out here today, and I'm looking forward to what we get done.
And it's time to really enact some real changes. And so we have the attention of folks right now, and so we have to follow that up with real policies that change the system. And that's what we're hoping to continue the momentum towards.
Even if it's true, and I'm not singing lullaby to the youth. It's real in the field, knowing it's safe. If they want you, they find you or be a cool case. You gotta have many occupations. Get out, get it, homie. No patience, get up, no sitting down, no waiting. Do the right thing so you don't see Satan. But can't forget about the hatred. Opportunity comes and there for they take you. This is slave ship. We were hustling, we were kings and queens. They're trying to tell us we was nothing. Black lives. Let's go, hands up. Hoods, ghettos, projects, blocks. They came to the top, we grind to the top. Your hustle won't die, keep pushing, don't stop. Turn it up. This is for the have-nots. Hoods, ghettos, projects, blocks. They came to the top, we grind to the top. Your hustle won't die, keep pushing, don't stop. Turn it up. This is for the have-nots. This is more than music, this is my life. Everybody's scared to die, no one living right. Never stand up for less, head up, but I'm stressed. Easy to give advice if you're not being tested.
Looking at the coronavirus pandemic now, today in New Jersey, Governor Phil Murphy signed an executive order that will increase the number of people permitted to gather outdoors to 100 and will permit the number of people to gather indoors to 25%. All outdoor recreational and entertainment businesses in New Jersey will be permitted to open on June 22nd. While this is happening, efforts of COVID-19 relief also continue to uplift and empower the community, with several Indian American organizations and nonprofits stepping up to combat food insecurity as well as the economic ramifications of COVID-19. In Piscataway, the Gayatri Chetna Center is practicing its mission of giving back with its COVID-19 relief efforts comprising of distribution of food to community in need as well as frontline workers. Here is their recent effort which took place at the Piscataway Town Hall.
Hi, my name is Dana Korbman. I'm Chief of Staff to Mayor Waller here in Piscataway, New Jersey. And on behalf of the Mayor and the entire Township and the Council, I would like to thank the Gayatri Center for their generosity, providing meals to the staff working hard here in the administration building and the police department. They've been very helpful to our students in our schools, providing supplementary meals. It's a great partnership, and we appreciate all of their efforts on our behalf.
And during these trying times of COVID-19, it's quite difficult to continue to remain positive and to be energized with all the trying times. So I thank the Gayatri Temple for this food. Along with the Mayor's Office, we're very appreciative for the offerings that they've brought us. Thank you very much.
I get to go home.
You're not going home.
During these times, it is important to support our local community, and that's exactly what we're doing. On this auspicious day of Gayatri Jayanti, we want to do our best to spread a bright light in the world. We want to do our best to come together and unite during these times, and that's why we're gathered here today.
Here we are gathering today to appreciation to Police Department and Piscataway Township employee, because today is a Gayatri Chetna anniversary. And because of that, they are just doing appreciation to the employee who work for township year around and helping the community. So this is one kind of appreciation year, one day a year. And also this Gayatri Chetna Center, behalf of mayor and all staff, I'm really appreciate because year around they're doing all the help in township for cleaning and all the stuff whenever any occasion. Plus, every day from last 2 months, another 1 month, they are doing in a school for kids the hot meal. Every day they just provide the hot meal. So, behalf of the township and the school board, I want to really appreciate to Gayatri Chetna Center what they're doing. And this is very important to help each other, because if we are the community, we supposed to mingling with other community and support each other. So I want to request all the ITV viewers, please be safe, stay home. Thank you.
We have served 12,000 fresh meals to needy kids of Piscataway Township. We have been doing that service since past 2 months, and we hope community supports us so we can do many such community services. Thank you. Jai Gurudev.
Time for another short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia, Voice of the Community, and I am Aditi Lamba. Continuing our report now on the coronavirus pandemic, its updates and measures. Earlier today, we spoke with Dr. Tushar Patel, who joined us for a virtual conversation from New Jersey. More than 7.1 million cases globally of COVID-19 today, with at least 406,000 deaths. In the United States, there are currently more than 1.9 million cases of COVID-19 with at least 111,000 deaths. Top health expert Dr. Anthony Fauci said that there will be more than one winner in the COVID-19 vaccine field and praised the rapid response of pharmaceutical companies in working towards a vaccine and therapeutic for coronavirus. Bringing more insight into vaccination at high-risk South Asians as well as social distancing, Dr. Tushar Patel urged all again to be safe and take precautions.
The early winter, end of this year, is the goal to have the first vaccine available. Unfortunately, that vaccination doses will not be enough to vaccinate 300 million people in the US.
Yeah.
So the first priority will be the medical professionals, the first responders, the healthcare providers who work in the hospital or the frontline workers. So it's going to be a huge deal for this country to protect themselves until the vaccination is available to all US citizens. And I think that will be not until early spring 2021.
Dr. Patel, just in terms of vaccination here, I just had a follow-up question. Usually vaccinations and building them takes years at times for many of these diseases. What has sped up the process here? And would we really have a validated vaccine by next year in terms of, knowing what the prolonged effects or side effects could be of that vaccine?
Yeah, so the phase 3 clinical trial enrolls about 30,000 people to ensure the efficacy, the safety of the vaccination. So I'm pretty confident that whatever is done with the FDA and under the supervision of FDA is going to be definitely a weighted out vaccine. Unfortunately, we don't know how long the vaccine will be effective. If we take it this year, do we need another vaccination next year because of a different strain? So all those questions are unanswered at this point. As you know, this virus is only less than 6 months old. So we are learning in medical community as well as public health. A lot of things we are learning on a daily basis. And I think by the time we know exactly, I think it's going to be another year and a half.
Wow.
We may see a second wave or the third wave this fall, next winter, winter 2021. I think it's highly likely without the vaccination, this is like a flu virus. It's going to happen every single year. Hope it doesn't happen with a new strain. If it happens with a new strain, we need to come up with a new vaccine every single year. And that will be a very, very painful process, just like we go through for influenza every single year.
Oh, wow. So we are trying to be hopeful here for the vaccination and for it to last in the same manner.
Absolutely. And the immunity from people who were positive or who had COVID-19, we don't know how long the protection lasts for. So it's a very tricky situation right now. So if we put someone back to work in 3 months and he or she may catch a virus again. So we don't know that yet.
Oh, wow. Let's talk here about at high-risk patients, because this definitely impacts the South Asian community. We've had numerous doctors here really, reach out for people that have diabetes or heart disease or other chronic conditions to be careful. My question to you now is, we've seen 2 months of this. These patients have to go visit their doctors. They have things that they have to maintain. What is your advice to these patients now, and what do they still have to look out for?
So my advice to the patients who are suffering from heart disease, kidney disease, lung disease, diabetes, who has cancer, who are HIV positive, who has immunocompromised situations, they should be very, very careful. They shouldn't be going out and visit the family, visit their doctors right away. They should call the doctor to ensure that everything is safe. When they go in the clinic or at the hospital, they are properly escorted based on the protocol developed by the clinic or the hospital. So unless they have huge cardiac issues or eye issues going on, they should avoid going out, seeing their doctor at this point.
Are seeing patients yourself, have you seen that prevalent in our communities? Or if not, what communities do you see that impact the most right now?
So the minority communities, the African Americans, Hispanics, South Asians, we are always prone because, number one, we don't have enough resources. We don't have enough system in place for the health screening done. We don't have enough resources or the insurance, not always for all South Asians, but in some communities, that is the biggest disparity we see, that we don't have the access we need for the health screening, for diabetes, hypertension, for renal disease or cancer. I think those individuals are at high risk because if they get the virus, we don't know if they have cardiac disease or if they have renal disease unless we screen them. And by the time we screen them, it's too late. So I think we lost few South Asians in New Jersey and New York because of those conditions as well. And like I say, African Americans and Hispanics are at the same or the higher rate because of those pre-existing conditions which are unknown to them.
Then how important is social distancing right now? Well, we're talking about racial disparity. We're talking about still, the need of more treatments. We're talking about waiting on the vaccination. What do we all need to continuously do right now, according to you?
In my opinion, social distancing becomes more important now than before. I think we still need the social distancing. When we go out, we need to cover our faces with the mask. Face coverings needs to happen. Social distancing means we need to keep the distance at least 6 feet from each other. Try to avoid the elderly individuals or the people with comorbid medical condition should try avoid going out. There is no right now. There is no season for us to go to the beach. It's premature to do that. I think my advice to stay put unless something essential you need to go out and get it, you can do so. But basic things, wash your hands, cover your faces, social distancing are still in effect. We are not off the hook with the virus yet. Second wave or third wave is likely to happen. And if we take those precautions now, and I think it's working. I think we have seen it. We have flattened the curve. It's working. So if we can continue doing so, I think we see some good results by this fall.
What has this experience taught you in the last few months? And how challenging has it been for you and the medical community?
First of all, I would like to express my sincere gratitude to all frontline workers, physicians, nurses, and all healthcare providers and the first responders, the police, the fire, the entire law enforcement agencies. They have been doing a tremendous job, especially in New York and New Jersey, where we had the epicenter of the COVID-19. And salute and hats off to all those individuals. For myself, I think this is like a lesson learned. We can learn a lot of things because this is not the last time we'll have this kind of pandemic or epidemic in this country. So we need to be prepared. We need to plan ahead of time. We can't be looking for the ventilators or the PPEs at the last minute. We should have all the stock supply at the state level, at the federal level, at the hospital level to have a better response. We could have saved many, many lives if we had all those things and the testing available on time.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight. This is Vision of Asia and I am Aditi Lamba. Take care and be well.